Hi, everybody. Okay. Hello. Okay. Crazy mom here. Don't care today. If you want to know what laundry looks like at a fifth wheel, this is it. Got a big pile down here. Oh, I guess you can't see it. Got a big pile right here down below me. And yeah, it's going to be laundry day today because we are getting ready to change locations, change states. So we are prepping to get that done. And so say hello. Let me know where you're joining in from. And I'm going to make sure here that we are live. It is so strange today. It's not letting me see anything. So awesome. But I want to be able to see your comments. Oh, let's see. Okay. Sorry about joining in behind, and we're behind the curveball today, but I want to welcome those of you who are watching on the replay. You're going to want to stick around because today we are totally designing our ideal healthcare situation and our ideal healthcare scenario. And so you're going to want to stick around. If you want to fast forward through the first couple of minutes of introductions and things like that, then you can do that. And then those of you who are live, hello. My name is Amy Miller. I am the founder and wellness advocate for 3 Life Essentials. My husband and I were passionate about helping others feel better naturally. And people tend to call me a research queen. Even back in my speech language pathology days, all of my coworkers, they saw me as kind of the resource and the research queen. I love seeking out and learning new things. And people know and trust that when they come to me, they know they're getting sound advice and that it's been researched and really well thought out. So come learn alongside me this week as we seek out the ideal healthcare scenario. So what about you? I'm really curious about this. I want you to name 2 words to describe what your last doctor's visit was like. So think back. What 2 words came to mind? I'm thinking back myself, and when I think back to actually many years ago at a doctor's visit, 2 words that come to mind are really narrow focused and hurried. But actually my most recent doctor's visit, I guess the 2 words I would have to describe it is very conversational, and the wait time versus visit time was small versus large. Does that make sense? Wait time versus visit time. Yeah. Unhurried. Yeah, with the visit time. So I'm curious, yeah, what, even if you're watching on the replay, what 2 words would you use to describe what your last doctor's visit was like? So we're going to talk about what are some changes that would make the healthcare system better. And I want you to dream with me about what's possible. And then we're going to talk about jumping on board. So today we're going to be free from wait, free to be heard, free to have options, free to make our dreams reality. So thank you guys for joining in. And if you're watching this video and you have some friends that you want them to experience their best year ever, or you know that this topic would resonate with them, go ahead and click the share button so that they can also benefit from this information. So let's talk about the tale of 2 doctors' offices, okay? First is the usual. Before you even walk in, you're already on edge. And regardless of why you're here, you know that the waiting room is going to be a cesspool of germs and diseases and kids with colds and bronchitis and flu and pink eye and every manner of germs that will be thrown in together in a room, right? Where you're going to wait 45 minutes and then spend 10 minutes with a nurse and 5 minutes with a doctor, right? And actually, doctor's appointments are often scheduled at 15-minute increments. So the doctor really hasn't got much time to allow to spend with each person. And it's not that doctors are bad people. In fact, quite the opposite. I have many doctors who are fantastic. And the vast majority of them get into this profession to help people. But they're often constrained by this system that they're forced to work in, which means that they get less time with people and spend more time on their computers and filling out prescriptions. And because of this one study showed that doctors interrupt or redirect their patients after only 23 seconds of talking. And still, this is actually still better than Bangladesh. Did you know that the average appointment there, it actually only lasts for a total of 48 seconds? 48 seconds. But you know what? In a study in 2017, over 1,000 doctors, 6 out of 10 of the doctors agreed. They said, my visits with patients are often too short for me to answer their questions and treat them effectively. That sounds like a big problem, not only on the patient end, but also on the physician end. Everybody seems tied down by this whole system. So, so I said this was a tale of two doctors' offices. So let's delve into that about the second one in just a minute. So, so I'm curious, put a 1 in the comments if you spend more time waiting for the doctor, or put a 2 if you spend more time talking with your doctor. The experiences that I was mentioning before, the one that we had earlier this week, I would have to say it was a 2. We spent definitely much more time talking with the doctor than we spent waiting. And so I want to share with you, let's kind of dream about the possibilities a little bit, but I want to share with you, this was an article I read, and this was from a physician in the Oregon area. And she just said she had an epiphany back in 2004, and she decided to start meeting face-to-face with people in her community of Eugene, Oregon. And she said, what's stopping me from serving the public? I want to find out what the community wants. And so she started hosting some town hall meetings, inviting just ordinary citizens to help really just create the clinic of their dreams. So I want you to begin dreaming with me. Just all across her community, she started meeting directly with people and listening. And everyone from bus drivers to businessmen, housewives, healthcare workers, to design a new model. And from over about a 6 weeks period of time, she wrote a document and came up with 10 things that most of the community wanted. And so I'm going to read those to you, and I want you to tell me, I want you to put in the comments below which ones resonate with you most. Like when you dream of your ideal healthcare clinic, when you're praying about your health needs and your wellness, your overall wellness. Speaking of wellness, I've got my hot water with my lemon and apple cider vinegar cayenne with some oils in it, and also some collagen. Wellness. Okay, so here were the top 10 recommendations. The first one was real relationships. People want practitioners who are fully present and willing to touch them emotionally or spiritually or physically. One woman's simple request was just hug me. How many of you have a physician or a practitioner that you have a real relationship with? I can think of 3 that I do. Yes. So what about physician role models? That's a second request. Happy, healthy doctors inspire patients to live happy, healthy lives, right? I'll never forget when I was in when I was in graduate school on the University of Oklahoma Health Sciences Center campus, where there were medical students, dental students, other therapy students there, other medical professionals and healthcare professionals all going to school there. And I remember meeting professors of all of these health-related professions. And I remember in particular, one was nursing. And there were all these nursing professors talking about health and wellness, yet they themselves were obese and smoking and not taking care of their bodies. Now, they were overworked and overstressed, I'm sure. But people aren't inspired by that. They're not inspired to become great doctors or healthy patients if they see their doctor or their healthcare professional telling them to do certain things and they themselves aren't living that out, right? They aren't happy and healthy themselves. That spills over. Okay, so what about the third one? Integrative healing. People want all of the healing arts professionals to be concerned for their well-being. They want it to be easily accessible, on-site complementary therapies like massage, yoga, acupuncture, essential oils, chiropractic care. They want that integrative healing, right? So number 4 was sacred space. An ideal clinic is a sanctuary, a safe place, a place of wisdom, a place where we rediscover our priorities. Number 5, she discovered easy access. They wanted same-day appointments offered and that everyone receives care when they need it. Listen to this one. Number 6, they wanted relaxed appointments. They wanted visits to be at the minimum 30 minutes. Patients wanted to be able to speak interrupted and feel heard and understood and cared for. How many of you have felt interrupted in a healthcare appointment? I know I have multiple times. Okay, so number 7 was patient-centered care. One person's advice was abolish the cookie cutter medicine because everybody doesn't need the same thing, right? Everybody's different. Number 8 was community orientation. Patients want a doctor who's part of the community and knows everybody by their first name, knows patients in a social context. How many of you have a doctor like that who's a part of the community and she knows everybody or he knows everybody by their first name? Yes, I do. And then what about creative financing? Offering patients a variety of different payment options, monthly stipends for services, sliding scale discounts, accepting donations, bartering, insurance when possible. And then the last one is health education. And really just transitioning from this ambulance care delivery system based on intervention and go to one that's more of continuing education on all the possibilities of health and well-being, like in that wellness pyramid that we've talked about. So isn't that interesting? So this doctor found 10 things that this community wanted. If you're just now joining, go back to the beginning so you can catch those dreams that this community had about the ideal healthcare clinic. And so I want you to think through. And if you're watching this and this is resonating with you, click the share button with your friends who would benefit from this. Ooh, that cayenne is getting to me. Okay, so let me share with you. There are clinics like this happening and opening across the country. They're called Prime Meridian. And I want you to, I'm going to give you the link to access a little bit more of this information so you can look at it and delve into it more. But I'm going to share with you a few of the highlights of what this healthcare clinic system is working towards doing. So they are working to provide integrative medicine. And that means, what that means to you as a patient is that it's going to be a delivery model that provides traditional medicine alongside with complementary medicine in an integrated fashion. Excuse me. There will be board certified physicians. It will be working on a monthly payment system, no billing insurance, no copays, no things like that. And there'll be simple access to appointments, even follow-up care that can be done remotely if you're not in the location where the clinic is closest to you. You will have at minimum 30 minutes with the physician, 30 minutes to an hour. Many patients are already experiencing that they're feeling like a positive energy when they get into that clinic or when they talk to their doctor via telemedicine. These clinics will be providing acute care for when you have that ambulance, those things that you need to reactive medicine, the ear infections, the cold symptoms, those kinds of things, the pink eye. We'll also be addressing chronic conditions, things that require a little bit more attention to things. They will also be focused on medication reduction strategies, working on reducing those and increasing your quality of life so that you're not experiencing as many of the side effects with those things. There'll be 24/7 triage, physical examinations, and then also nutrition and wellness management. And they will also, to those of you in our oily world, they will be providing also prescriptions for essential oils, for doTERRA essential oils as well. So there's a whole FAQ section on the Prime Meridian Healthcare Clinic, and you can find a clinic near you. What I want you to do today, if this is resonating with you, I want you to go to the Prime Meridian Clinic website, and I'm going to give that to you in the comments below after the replay. Or actually, let me see if I can do it for you now. Yes, okay. So I'm just posting the link, and here's what I want you to do. I want you to go to the Prime Meridian Healthcare Clinic section. I want you to click on the button, Find a Clinic. Now, right now, it's only in 4 locations, but I want you to click on View All Clinics, and I want you to enter your location or your zip code, okay? And when you do that, I want you to click Search, and I want you to type in your information, because what they are doing is they are opening these clinics based on response for those who say, yes, I want that kind of clinic in my hometown. I want that clinic near me. And so you are going to type in your name, your email, phone number, and your location, and how many in your family, and they will put you and on a list, because they're grouping people together. And when there are enough people in a location, they will be opening in that city. And so they'll contact you when that's available. There are over 40,000 registered in the Prime Meridian Healthcare Clinic system already. So do that. Go to the website, join in with the over 40,000 who've already registered with it. Now I'm about to sign off, but next week we're going to be talking about how to protect our children's brains. And it may not be exactly what you think it is, but we're going to be free to protect and free to have a plan of action and free from porn. So if you're watching this, make sure to click subscribe to our notifications and like and follow our Facebook page. If you're watching us, you can join all of our replays on our YouTube channel. Just type in 3 Life Essentials on YouTube and you can follow us there. Thank you guys for joining me. We'll see you guys next week. Bye-bye.